psoas is. Remember, it is a hip flexor muscle. So because it's a hip flexor muscle, an easy way to do it, to find it, is to, of course, ask for permission. Do you mind if I am close to sensitive areas? And as you're feeling around in here, if you're not quite sure where it is, all you have to do is put a broad, fingers right over the area that you're looking for, and then have them flex their hip.
You're like in this hip area, right?
Yep.
There's my hip, and you're in there. That's where your broad fingers are
Yep,
going.
and so the ASS is right here, and so
Okay.
I'm just sliding, basically it sits right here,
Mhm.
because some people, their psoas is going to be displaced either more medially or sometimes more laterally if there's more of an iliacus type of involvement there. So that's why I'm going to give it some range, and then I'm going to have him flex his hip towards my knee. I'm sorry, bend the knee up. There you go, right there. So there's the psoas. So there's two things that we can do here. The first, we're going to kind of loosen things up, and I'm just going to do some gentle cross fiber friction and just warm up the tissue. Because once the tissue is warm, we're going to jump right into some of that active movement.
So what do you call it? Just warm up?
Mm-hmm. And so I'm just running around, moving in a circular fashion. As I'm moving, you'll probably feel an upward bearing movement, right?
Mm-hmm.
So as I'm rolling this way. And I'll explain why in just a sec. So we're loosening up iliopsoas. Once you feel comfortable that that tissue is good and warm, we're going to be using, remember, almost everything that we're going to be doing, we're going to be starting from a shortened position. So to start from a shortened position, you're going to be having them bring the knee up. Now, to get the actual exercise or stretch in, we're going to go back to that psoas, and then I'm going to do a slightly upward bearing contact. So I'm going to take up tissue slack. So I'm going to be going at approximately a 45-degree angle down, and then I'm going to have them extend the leg slowly. You can feel that stretch?
Mm-hmm.
And now remember, I'm not doing anything. All I'm doing is holding that position, and then I'll have them come up again, reset, back down again. Good, and we'll do it 3 times. One last one. And let's slide it on down. Good, into a rest. Perfect. So that's for the psoas. Super easy, right? You're just basically going to shorten the muscle, you're going to traction it, and then you're going to have them extend whatever limb that is to get the stretch in that muscle underneath your hand. So that's the first one, is the psoas. Now the second one is going to be the abdomen. Now, what is the main, we'll call it for low back pain, what is the #1 abdominal muscle that helps with low back pain?
In the abdomen?
Mm-hmm.
I would think it'd be the transverse.
That's right, transverse abdominis. That is, or what I like to call the cummerbund muscle, because it looks like a cummerbund, right?
Mm-hmm.
And what's cool about it is, if you're talking to somebody that's got a lot of low back pain, like chronic low back pain, that is the muscle that you strengthen to start getting some of that horizontal stability. And the #1 exercise to do that is Pilates. So if somebody is having that chronic low back pain, that's going to be the suggestion. You know, if you haven't tried Pilates before, it specifically targets and helps to strengthen the core. The core is going to
Like
give you
I have.
stability in the low back. Right. And that's all you got to do. So there's no specific technique for transverse abdominis. You've done some particular work with abdominal massage, right? In some
Just
of your classes.
relaxation. We haven't got
Exactly.
there.
That's all
yet.
you need.
Okay.
Because you're not going to be, because of the dynamics of those abdominal muscles, you're not going to get the same kind of traction you are with these individual muscles. It's just what it is. Like, the reality is, if you wanted to do something, what you would have them do is you could hold basically slightly traction down, and basically they're going to do a crunch, and then they're going to expand out. Crunch and expand out. But again, I would highly, I don't think it's really necessary. Okay. So we've gotten,
written that one down yet.
so we've gotten the psoas. Now, anytime you're going to be dealing with low back pain, we're going to be looking at the other pieces of that kinetic chain, right? So in the anterior side, that's going to be your quadriceps muscles. Now, what are the 4 quadriceps muscles?
rectus femoris,
Mhm.
vastus medius,
Mhm.
vastus lateralis, vastus intermedius.
Perfect. And so, easy, simple technique to get these to release, and just location first. So the way I find these muscles is really easy. So naturally, you're going to find the rectus femoris really easy because it's right over it. It goes do, 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 do. But it's a more superficial muscle, right? The vastus intermedialis is underneath it. So first to find the vastus lateralis, palm of my hand over the patella, and then I rotate my thumb. So my thumb is going right up, going towards the head. That's going to put you right on that vastus lateralis. For the vastus medialis, it's the same idea. As your thumb comes up, your thumb is naturally going to be to the side, right? And it's going to fall right on, right basically where you want to be working in that tendomuscular junction. And then of course, what I do for
So I use my other hand to do the other one?
no, I mean, it doesn't really, you're basically, I mean, technically, yes, if you want to kind of do the whole thing,
Okay.
it's just an easy way to find it.
Okay. There's one, and then the thumb over here is the other.
Yep.
You want a pillow?
No. You can feel them.
Yeah, I mean, because he's a climber and whatnot, he's got good muscle
An
definition.
anatomical diagram.
Yep. I appreciate you. Okay, so this is going to be real, another really straightforward.
All we see is baggy pants. Just by the way, I'm sorry, but we're not telling you how fabulous
Yeah,
your
look at that.
climbing legs are.
That's beautiful. Okay, so we're going to be doing the technique to release these pieces is going to be a bicycle. So the bicycle looks like this. You're going to have them slide their heel along the table. It's going to come straight out, and then the whole thing comes back down.
Oofda.
So find that location, thumb over thumb, and go right into a horse stance, and then I'm going to, and so this is a upward bearing
Lunge or
movement.
horse?
I'm in a lunge. Fencers. Okay, so thumb over thumb, and then I'm going to have you slowly bend that knee, sliding the heel along the table. You'll feel it immediately. This is a deep, deep stretch. So I'm not pushing very hard. This doesn't require a lot of energy. And then keep the leg out, and then right back down. So that's one. Come to the center. So really superficial, because this time I'm
So you're
just
doing the attachment.
well, this is a little beyond. So the attachment is here. Well, the attachment for rectus femoris is really here, but we're going into that tendomuscular junction. That's the money.
Patella.
Yep. So basically, think of it like the line of your thumb here. Go to the edge of the patella. Boom. Edge of the patella. Boom. Edge of the patella. Boom. So those tendomuscular junctions are about an inch away from the corner. That's the special stuff. That's where you're really going to get that much traction. But again, right in the middle here, when we're dealing with the rectus femoris, is because it's a more superficial muscle. I'm not going to be pushing in anywhere near as deeply in this first round. So I'm going to, and you can hold right underneath just to get that traction. So I'm going to give it just a little bit of lightness, and this time I'm going to give it a little bit more push upward towards the head, and bend the knee for me. Good. As you see, I'm shifting forward, kick out, and right back down. So one of the things that this technique typically you want to be thinking about is the height of your table. So naturally, if you have a table that has a pneumatic up and down, it's going to be a lot easier to do a lot of these techniques. But if you don't, you just want to modify your body mechanics so that you're being as efficient as possible. Okay, so then we're going to come over here to the vastus medialis, and let's do our bend. Bend, 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 bend. Good. Kick out and back down. And then the last one is going to come back to the center, but this time we're going to go deep. All right, so we go in and let's go for the bend. Bend, 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 bend. Now keep in mind you're going to be on skin and not on. It's a little bit harder to do on like jeans and things like that. But most likely, if you have yoga pants on or something like that, your client has yoga pants, it's not a problem. Good. So that's to clear the quads. Now, one really cool thing about this technique, if you work with runners, this is one of the best techniques because especially for the vastus lateralis and vastus medialis. So one of the major things that runners have an issue with is going to be what's called runner's knee. And runner's knees, typically the vastus lateralis becomes shortened, and what it does is it pulls the patella over and up. And when it does so, it's going to change the way both the knee and the ankle track. So typically your runner is going to lose, especially like if they're running a marathon, something like that, they're going to lose minutes because they're going to be slowed down throughout the entire chain of movement. So free this up, free up the ankle. You can free up a little bit of the tibialis anterior. We'll go into lower leg at a different time, but just to know that, you know, if you're working with a runner, you got to work that entire chain. Okay, perfect. Okay, so this is
when you do this, you're considering that part of your hip.
Oh yeah, that's
Okay.
I mean, because everything is in context of the way the hips are moving right now.
Okay.
Because we're just focusing, literally we're focusing basically from here to here. Okay,